If you suspect your cat is unwell and could be actually unresponsive or unconscious, approach them carefully. Just try with the back of your hand or your foot, just stroking them. Call their name. If there's no response, you then need to open the airway. So tilt their head back, lift their chin, open the airway and check for breathing. And you can do that with the back of your hand, or if you have established that they are unresponsive, by putting your face close and see if you can feel them breathing or feel their heart beating by pushing down on their side where their heart would be. If they are unresponsive, then you should start CPR, unresponsive and not breathing normally. And what you are doing is you are then being their heart for them. So you would start by pushing down hard and fast on their chest, like that. So a couple of fingers, depending on the size of your cat, but for most cats, a couple of fingers like that, 2 per second, and that is giving them some compressions and pumping the heart and pumping the blood round to the heart and the brain. After your 30 compressions, you would then do mouth to nose breaths. So you would breathe into them a couple of times and then back to pushing on their chest again. And realistically, if you haven't got a response within 2 or 3 times of doing this, I'm afraid it is unlikely that your cat is going to make it. However, please get them to the vet as quickly as you can.